I want to wear these glasses on camera, but I simply can't. Anyway, I know I've been doing actually most of my videos these days have some sort of sponsor because I am poor, but I wanted to do a quick shout out, an ad, if you will, for my friend's small business. She's currently making things like keychains, rattle rings if you have children, but the thing that I am the most interested in are the badge reels. I wanted to show you some that I got. At this point in time, I've already gifted these to my friends. Mine is in the car, it is raining, so I'm not gonna go get it, but I wanted to show you some in case you were interested because she ships anywhere. So if you wanted to buy one yourself, you absolutely could. And I will include the link to her Facebook page in the description, but there's this one. So basically you just put your little badge on there. This is an incredible gift or a thing for yourself for healthcare workers. This one, if it has like an icon bead, mine has a cow on it. I'll try to post a picture, but she makes all of them herself and she's wonderful. And I think if you can afford one and you need a badge reel, isn't this so cute with the little wooden bead? They're customizable. You can ask for whatever you want basically, and she ships anywhere. So if you want one, you should check her out. Her name's Morgan. The business is called Baisley's Boutique. I don't think she knows I'm doing this at this point, but I'll tell her. That's it. Enjoy the video. Goodbye. Hello friends, welcome back to the channel. This is the second video I've posted in a row, which means it's made from Christmas break. It is not present day. I wanted to talk about in this video how to be a successful clerkship student on medicine, and then I'll make a separate video on surgery specifics, some things I thought were helpful, things I did wrong, or things that I ended up getting a little bit better at, so that you can take this knowledge and apply it to your time on clerkships. I would say medicine is one of the harder ones, at least at my institution. Surgery is the other hardest one. Big things are presentations. So presentations are gonna be one of the things, at least at my institution, that's sort of an outward expression of how prepared you are, how much time you spent with the patient, how much time you spent preparing and reading about the patient, and what you know about what's next in the clinical context. So I started on surgery, and so my presentations, I have given medicine presentations in the past, but was sort of really only involved in clinical care for surgical patients until the last 8 weeks. And so my presentations prior were in the SOAP format, which is subjective, objective, assessment, and plan, which I still kind of used for my medicine rotation, just like more detailed. So I would say if you've never heard of this presentation style before, it's called SOAP, S-O-A-P, subjective. How's the patient feeling? What did they report? Objective, vitals, physical exam, imaging, labs, data, assessment, just like restating your one-liner and like summarizing how they're doing in like 1 or 2 sentences, and then your plan and what comes next. So I would say big things are, you probably, if you are approaching clerkships, have done this before, have given a presentation before. If you haven't, that thing that I just said is a really good template for approaching presentations. I always was like, Mr. Jones, like spoke to him this morning, he reports feeling well, his pain has resolved, he has like notably no abdominal pain, he's past gas and all, like, I don't know, you just like tell the story from their perspective. The way my attendings liked it, and one disclaimer is like all presentations are really attending specific, and so this is not what your attending said, listen to them before me. For objective, I found that most of my attendings liked when I started with vitals. So every morning you write down their patient's vitals and look at them. I feel like there's a difference, and you'll get here if you don't already do this. I feel like there's a difference, and I saw myself becoming this, is I write down the vitals, and then like a couple weeks later, I'm like, but what are they? What do they mean? Like there's a difference at the beginning of your medicine clerkship where you're like, I have the information, and then you start to become more of like an interpreter or a manager where you're like, but what do they mean? And what does that mean for the state of the patient? When you're first starting out, at least have the information at the ready in case they ask. So vitals first, and then I always did my physical exam, head to toe usually. They do like a focused exam, but also since you are a medical student, some attendings will ask you about the neuro exam if they have abdominal pain. So do be thorough But if you have a limited amount of time, like learn to do a focused exam. But I found that it was really helpful, especially when I was chart checking patients in the morning, as far as physical exam is concerned. If they had a symptom before, like if this is a patient I've been following, if there's something that we're tracking, I would write down on my sheet of paper, like, do this physical exam maneuver. I am like pretty new to doing JVD, jugular venous distension, like looking at people's necks, and I would sometimes forget to do this, and so I found it was helpful to write it down as like a task to complete on my sheet of paper, on my patient list, whatever. I have like a bullet journal that I would take around, and that's what I kept track of my patients with. But write down the physical exam things that you want to do, if there's any special maneuvers that you like normally wouldn't, or things that you want to ask the patient to make sure that you know like how they're progressing. I find that that's very helpful. And for new patients, if you're doing like the history and physical, or sort of like writing that patient up based on their chief complaint, like what's your differential and what are the physical exam things that you want to rule them out? What are the lab things that you need to rule it out? What are the imaging things that you need to rule that out? Even if the team doesn't do those things, I think that's a really good exercise if you do have time to think through it before you see the patient. If you just know the chief complaint, and then you know what things to ask if you're like, I can't figure out what's going on. Do you have swelling in your legs? Are you having shortness of breath? And if the answer to that is no, you can maybe move away from like volume overload and move to something else. Physical exam. I felt like this is where my presentation started getting really good, is when my objective section was like growing and more rich. So before I would just do vitals, physical exam. So then add to that lab values. What has come back in the last 24 hours and how has it changed from prior? So if somebody has a kidney, in like an AKI, acute kidney injury, what was their creatinine yesterday and what is it today? What was their BUN yesterday? What is it today? What was their EGFR yesterday and what is it today? Like keep track of those things. What was their potassium and is it getting better or worse? And so some like phrasing, I'm sure everybody knows this, probably. I don't mean to be paternalistic, but if you are looking for phrasing, I would always say like creatinine is 2.1 improved from such and such yesterday, or creatinine is such and such downtrending from yesterday or up from yesterday, just to keep it succinct and like really just a statement, because your objective data shouldn't have your interpretation in it. That's some like phrasing that I found was helpful. And then any pertinent imaging that's like found something or is giving some new data to the problem. Sometimes all of this is dependent on how able you are to chart check, and different systems are difficult to figure out, or imaging will be in a different section than like the ultrasound will be in a different section than the x-ray will be in a different section from the pathology reports. So the more proficient you get with chart checking, the easier this will become to have like a rich objective section. But that's something that if you're like really looking to up your game, is to really make sure that you know everything that's come back for the patient. Act like you are the primary person. And I know that's a cheesy thing that people say and you're like, what does that mean? I'm not actually like making these choices, but important to know. Other things I would say is like, has medication changed? Has dosing changed? Did we stop or start any new medications? Are they on their home medications? Did we get a trough on their vancomycin? Like all these different things to sort of watch. And as you get more advanced, and as I get more advanced too, I feel like medications are a big downfall for me because I just don't really know a whole lot about them. Haven't taken step 1 yet, so I have much to learn. But as you know, like we started this new medication, what are some possible side effects of that? And include that in your physical exam. Like we gave them vancomycin and they do not have a rash. Like you don't have to say it like that, but just like know to look for things if you've made any changes, because a lot of things happen iatrogenically in the hospital. So that's important. And then for plan, I feel like this is also a place I need to grow quite a bit in, but this is where a lot of your learning can happen, because in my previous video, I talked about how the shelf exam is very protocol dependent. And so becoming familiar with protocols for like common diseases is important. Treatment protocols, what to add, what to subtract, what lab to do next, what imaging you need to do next. include that in your plan. And I think I would challenge you, if you are looking to grow, is make a plan even if you have absolutely no idea what's going on. At least at my institution, the attendings were really understanding that we're like baby second years. So I started my medicine rotation on like my 9th week of the second year. So I really don't know a whole lot about treatment plans. I know disease processes, and this year is like a big growth for me in that sense. So I would challenge you and myself to continue to make plans even if you don't know what to do. Say like, I think there was one time where I wanted to get a CTA for something or other, or I wanted to do a CT. This was recently. I wanted to do a CT abdomen and an ultrasound, like a renal ultrasound, to check and rule out for like a pheochromocytoma and like Zollinger-Ellison, because I was in endo clinic and there was some random stuff happening. And he's like, I see where you're going with this. Like, I see why you want to get those things, but this is actually what we do for that. Like, this is the thing that we do first, and it was blood tests, and that makes sense. But if you don't know and you've never made the plan, you won't learn. So it's okay to be wrong. I was wrong a lot, and I think that's a good way to grow. As long as your attending is nice, which most of mine have been, and my residents were all wonderful. So don't be afraid to be wrong on your presentations. I would say other things are anticipation. This is important for surgery in a different way, but in medicine, like, anticipate what the patient wants or needs, what's going to happen. Anticipate what your team needs or needs help with. There are some times where they'll be like, okay, I need to call this patient, I need to get these records, and I need to such and such. And if there's anything you can help with, I know it's like you're paying to be there and you're there to learn. And if you're not there, you're not learning, maybe you should like go home and study. But if there's anything you can help with, like, oh, maybe I could call the family, or maybe I could like call this hospital and request these records, or maybe I could fax that over for you, just makes a world of difference for your residents. They're working so hard and need us to help them instead of be like asking a million questions, which you should do. Just balance your questions and your helpfulness so that you're at least net even for residents, because they deserve the world. Other things I think that are helpful and that look really good are circling back, talking to your patients in the afternoon. One thing I've heard a lot from residents is that they like miss being able to like spend time with the patients and talk to the families and inform them of what's going on. I think it's good practice as long as you're not like practicing and don't actually know what's going on at all. Like, the patients and their families trust you as a medical professional, so you shouldn't go in and like spew misinformation. But if you are able to go back in, for example, I went back in to talk to a patient and like pulled their CT up and showed them like, this is what they're looking at, this is what they mean when they say interstitial fibrosis, and this is what it looks like, and this is what the radiologist said. A lot of patients have access to that information now, but they don't really know like what's going on, and explaining to them like, what does it mean that your creatinine is a little bit higher today, or what does it mean that we're checking this lab, what are we looking for, so that they stay sort of like up to date. They really appreciate that, and I think the residents appreciate that too, because if you don't answer their questions, they sort of build up, and then sometimes they can get grouchy for good reason. So that's helpful. You should do that if you can. Make sure you're eating and drinking. Those are things that I didn't do super well. Exercise sort of fell off for me. I probably went like once or twice a week, which is abnormal for me. But seasons of life. Just make sure that you are sleeping, eating, drinking, taking care of yourself, because it's pretty easy to not do those things and feel like you have to be more productive than you are being. So don't do that. That's not good for you. Overall, I would say one more thing is, if you're working with, this is something that I don't know why I didn't know it before, and I'm glad that I haven't done it, but it's not something that ever really occurred to me, is you should never answer a question that is not asked of you. If you have another student on rounds with you and the attending asks them a question and you know the answer, no. Do not answer that question. You let that student answer, and if they don't know the answer, unless you are addressed, you do not answer that question. If they ask the resident a question and the resident doesn't know the answer to the question, you do not answer that question. The reason being, and I'm sure this has occurred to most of you, I just had never thought of it before, is like, it's kind of embarrassing to them, and also like it just is not a cute look. It's not a cute look to be like, oh, well, I know something you don't. And it's not, and I don't think anybody intends to do that, but that's sort of how it comes across. It doesn't make your fellow classmate look good. And also, especially, it doesn't make the residents look good if you like know some like weird fact that they don't. It doesn't at all mean that you know more than them. It just means you might know that fact better than they do. But everybody has a lot on their plates. That's not something you should do. That will not make you look good. Do not answer questions that are not asked of you. Don't do it. It just doesn't look good. And if you've done this before, it doesn't mean you're a bad person. It just probably means, like me, you've never thought of it before. And luckily I hadn't done it before. Like somebody was like, hey, here's a tip for you guys. Like, don't do that. I think that's all I have for you right now. But if you have specific questions, I, at this point, have done medicine and surgery. And when this video comes out, I will be on pediatrics. So if you have specific questions or things you want to see in videos, leave them in the comments. Sorry, I have a lisp. I'm straightening my teeth. All right. Thanks for watching. Thanks for being here. Thanks for still being here despite me being incredibly busy over the last couple of months. I really appreciate you all, and I'll talk to you later.